All right, let's dive into this. ABA therapy for autism. Lots of debate around this one. We're going to be looking at ABA therapy for autism, benefits, criticisms, and alternatives.
Yeah, ABA has been around for a while, decades in fact, but still, there are questions
Hmm.
about how well it works, how it's changed, ethical stuff too.
For sure. So to get us started, let's go back in time a bit. When did when did it all begin? What was the idea behind it?
Okay, so the roots were in the 60s with Dr. Ivar Lovaas, and he was a pioneer, believed that you could learn behaviors, even complex ones, and that you could modify them with reinforcement. That's the basis of ABA, that we can use these principles, these ideas, to help people with autism develop new skills, work through challenges.
Makes sense. But how does that look in real life? Like, what are the main parts of ABA that therapists are using these days?
Well, it all begins with a deep dive into the person's behavior. It's called a behavior assessment. It's like being a detective, trying to figure out which behaviors need focus and what sets them off. And then you bring in positive reinforcement. That's all about encouraging the behaviors you want, with rewards, with motivation.
So it's understanding the why behind the behavior and then using positive strategies. But I've heard that ABA used to use some pretty harsh techniques. How has that changed?
You're right. Early ABA, it did use techniques that, well, today we know they were harmful, not ethical. But thankfully, modern ABA, it's completely shifted. It's all about positive reinforcement, strategies that are respectful, motivating to the individual.
Good to hear. So positive reinforcement, that's the key. What about the stuff I heard about like DTT and NET? Sounds a bit technical.
Yeah. So DTT, that's discrete trial training. That's breaking down complex skills into smaller steps, easier to manage. Like teaching a kid to tie their shoes. You wouldn't just show them the whole thing at once. You break it up, cross the laces, make the loop, pull it through. That's basically DTT. Then there's NET, natural environment training. That takes those skills you've practiced and puts them into real-world situations. So instead of just tying shoes at a table, you help the child practice while they're actually getting ready to go out.
Got it. So you're taking those skills from, practice to the real world, much more practical. What about data? Why is it so important, the data collection, in ABA?
Data collection, it's like the backbone of ABA. It lets therapists track progress, see what's working, what's not, and they can change the therapy plan based on that,
Right.
fit the individual's needs. It's making sure the interventions are helping, making a difference.
So data isn't just like for spreadsheets. It's about actual results. So let's move on, talk about the benefits of ABA.
Yeah.
How can it help people with autism?
Communication is a big one. And it's not just about learning to speak. For folks who are nonverbal, ABA can help them find other ways to communicate. Pictures, sign language, technology even. And research shows real gains in communication skills for people who do ABA. That can be huge.
Yeah, expressing yourself, your needs, it's so important. What else does ABA focus on?
Social interaction is another one.
Yeah.
ABA helps people learn those kind of unspoken rules of social engagement, reading facial expressions, taking turns in conversation, cues, all that. This can help with social skills, social anxiety.
So it's more than words. It's like understanding the whole social dance. That can be hard for anyone, but even more so for those on the spectrum, I'd imagine.
For sure. Another big benefit is it helps reduce challenging behaviors, things like self-injury, aggression, repetitive behavior, stuff that can be disruptive and, well, distressing. But the key is you don't just try to stop those behaviors. You have to understand why they're happening. What function does that behavior serve for the individual? That's important.
That makes a lot of sense. So ABA is not about forcing compliance. It's about understanding their needs and finding positive ways to support them.
Exactly. It's about teaching them other ways to cope, to communicate their needs. And then those challenging behaviors, well, they're not as necessary. And that can be a huge relief for both the person and their family.
Sounds like ABA is about more than just skills. It's about overall well-being.
Right on. And another important point, ABA programs, they're made to be individualized. They're designed for each person's strengths and challenges. It's not, one size fits all.
That's good because, like we know, autism is a spectrum. What works for one person might not for another.
Absolutely. Finding the right approach, that's key.
Yeah.
But before we talk about making those decisions, we need to look at the other side, the criticisms of ABA. Because even though it has potential benefits, there are concerns we should talk about.
Definitely. We need to explore those criticisms to really get a full picture. Let's dig into that in part 2 of our deep dive. Okay, so we've talked about the good stuff, the potential benefits, but now let's get into the criticisms of ABA. Some people have, well, strong opinions. Let's get into it.
Yeah, for sure. It's important to look at those criticisms because they bring up some big questions about, individual choice and how we think about neurodiversity.
Right. So where are these criticisms coming from? What are people worried about?
One of the main things people bring up is this idea that ABA is all about compliance, like pushing people with autism to be like uh, neurotypical, to fit in, instead of just letting them be themselves.
So instead of saying those differences are good, it's like ABA is trying to erase them, like
Right.
trying to fix something that's not broken.
That's the worry, yeah. Neurodiversity, it's this idea that neurological differences, like autism, they're just natural. Variations in how people think, not something that needs fixing.
It's about recognizing that there are different ways to be in the world, but some folks think ABA misses that point.
Yeah, some people feel like ABA, it's too focused on changing behavior. It doesn't always get the emotions, the reasons behind those behaviors. Like we were saying before, it's important to understand the function of the behavior. What need is it filling?
So it's not just about like stopping the action, but about getting to the root of it, seeing the whole person, not just the behavior.
Exactly. And that leads to another criticism, which is that some ABA programs can be too rigid, like one size fits all. They don't always consider all the different ways autism shows up.
That makes sense. It is a spectrum after all. Each person is unique, their own strengths, challenges.
For sure. So when you're thinking about ABA or any therapy, really, you have to be thoughtful. Understand each person's needs and what they want.
Okay, so we've got some key criticisms here. Let's say a family is thinking about ABA. How do they deal with these concerns and make a good decision?
It's a big decision, yeah. Families should get info from different places, talk to professionals, really weigh the pros and cons.
So no jumping in blindly. It's about research, having those hard conversations.
Right. And if a family decides to try ABA, finding the right person to work with, that's really important.
I was thinking that there are so many different ways to do ABA. How do families find someone who, fits their values, their kids' needs? What are the red flags, the things that would make you say, nope, not this one?
That's a great question. One big red flag is a provider who's like obsessed with compliance. If they're trying to make the child seem normal, hide their autistic traits, that's a problem.
So it's about finding someone who sees the value in neurodiversity, not someone who's trying to, force the child to be neurotypical. Anything else families should watch out for?
Another red flag is if they use punishment or force. Modern ABA, it's moved away from those harsh techniques.
Yeah.
But you still got to make sure they're using positive reinforcement the right way.
Ethically. It should be encouraging, motivating, not controlling or manipulative, right?
Exactly. And families should feel okay asking questions about their methods, their approach. How do they individualize therapy? How do they handle challenging behaviors? Do they include the family?
Sounds like communication and working together is key, not like a dictatorship. It should be a partnership where families feel heard and respected.
Right on. And ideally, this provider, they should know about and respect neurodiversity. They get the unique strengths and challenges that come with being autistic. They embrace those differences, not try to erase them.
It's about seeing the whole child, not just some behaviors to fix.
You got it. It takes time to find the right person. Research, careful thinking, but it's worth it to make sure the child is getting the best support.
Okay, we've talked about ABA, the criticisms, we talked about making decisions, but what if ABA isn't the answer? What are some other therapies that families could look at for autism?
That's a good question. Because as we've been talking about, ABA isn't the solution for everyone. There are plenty of other approaches out there that might fit better with a family's values, a child's needs.
Let's talk about those other options. What are some other therapies that could help people on the spectrum?
One common one is speech and language therapy. This focuses on communication skills, whether that's spoken language, using other methods to communicate, or just getting better at social communication.
Makes sense. Communication, it's a big part of being human. What other therapies might families think about?
Occupational therapy, OT, that's another good one. It helps with sensory processing, those fine motor skills, and everyday stuff. Like getting dressed, eating.
So for someone who has trouble with sensory overload or doing things like getting dressed, eating, OT could help with that.
Exactly. And then you've got these developmental relationship-based models, like DIR floor time. These are all about learning through play and building those relationships. The idea is to create a fun, engaging space where the child can learn and grow at their own pace.
That sounds nice. Learning through play, who wouldn't want that?
Right. And then there's CBT, cognitive behavioral therapy. That can help with managing anxiety, emotions, and those tough behaviors. It teaches people how to understand their own thoughts and feelings and find ways to cope.
So CBT, it's like giving them tools to deal with the ups and downs. Important for everyone, but especially for those on the spectrum who might have more anxiety or trouble with their emotions.
Absolutely. And last but not least, we have to mention self-advocacy and those neurodiversity-affirming approaches. These are all about empowering autistic individuals, helping them embrace who they are, ask for what they need, and celebrate their neurodiversity.
I like that. It's not about fixing, it's about acceptance, understanding, empowerment,
Okay.
seeing the value in being different.
Exactly. It's about creating a world where we celebrate neurodiversity, where autistic individuals can thrive, be their true selves.
Okay, so we've got a whole bunch of options here. It's clear there's not one right answer for everyone. Families need to find what works for them, what their child needs.
Absolutely. And that brings us to a really important point, making informed decisions. How can families sort through all these therapies and interventions?
Good point. Let's talk about making those decisions in part 3 of our deep dive. All right, so we've gone through a lot. ABA, the good, the bad, the other options out there. But the big question is, how do families actually choose? What do they do?
Yeah, it's a tough one. A lot of parents, they really struggle with this. So much information, and it feels like a really big decision.
Totally. It can be overwhelming, trying to figure out what's best.
The first thing, and this is super important, is to get a good evaluation from professionals who know what they're doing. Could be a developmental pediatrician, a psychologist, therapists who specialize in autism, that kind of thing.
So getting a full picture of the child, their strengths, their challenges, what they need.
Exactly. That evaluation, it helps you figure out if therapy makes sense at all. And if it does, what are you trying to achieve?
Yeah.
It's the foundation for making a plan that really fits the child.
So you're not just jumping into something because it's popular or someone told you to.
All right, every kid's different. What works for one might not work for another. You have to think about their personality, how they learn, what their sensory stuff is like.
So it's more than just the diagnosis. You're seeing the whole child.
For sure. And that's where talking to the professionals is so important. Don't be afraid to ask questions. If you have concerns, say them. Speak up for your kid. You know them best.
You're not just sitting there listening. You're part of the decision.
Exactly. And if you are thinking about ABA, you really have to check out those providers. Ask them about neurodiversity. What's their take on it? Do they get it? Do they respect autistic traits? Or are they all about making the kids seem, less autistic?
That's a huge difference. It's embracing who they are, not trying to change it.
Right. And ask about positive reinforcement. How do they use it? Is it really positive, encouraging? Or is it more like pressure or manipulation?
Those are good points. You want someone who shares your values, someone you can trust with your kid?
Yeah, for sure. And remember, you're not stuck with one thing forever. If it's not working or your kid's needs change, you can always switch things up.
So it's not just a one-time decision, it's a process.
Absolutely. It's a journey. And you have to be flexible, go with the flow.
We've covered a lot, therapies, interventions. But in the end, what's the most important thing you want families to remember?
I think the big takeaway is there's no one right way to help a child with autism.
Hmm?
There are a lot of paths you can take. The important thing is finding what works best for your child and your family.
Finding a path that fits with what you believe, what your kid needs, what you want for their future.
Exactly. And remember, you're not in this alone. There's so much support out there. Other families, people who've been through it. Autism organizations, professionals who can help guide you.
That's huge. It can feel really lonely sometimes, but knowing there are people who understand, that can make a world of difference.
For sure. So as we wrap up our deep dive into ABA therapy, I want to leave everyone with this thought. The world, it needs autistic people. Their unique ways of seeing things, their talents. Let's create a society where we embrace neurodiversity, where we celebrate all the good things it brings.
That's a beautiful thought. It's not about fitting in, it's about belonging. And to everyone listening, thanks for being here with us. We hope this deep dive has given you some knowledge, sparked your curiosity, and helped you feel more confident in making decisions for yourself or your loved ones. Until next time, keep your minds open and be kind.